Imagine you're assessing an older adult patient, and their chart states, quote, age-related changes. What do you look for? Let's dive into a case study to sharpen your clinical reasoning and nail this NCLEX-style question. Meet Mrs. Jones, a 72-year-old patient here for a comprehensive physical exam. Let's apply the ADPIE framework to assess her age-related changes. First, we assess body systems for age-related changes. Mrs. Jones might have trouble hearing high-pitched sounds, a condition called Presbycusis, our novel term today. It's the gradual loss of hearing due to tympanic membrane thickening and inner ear sclerosis. We also check her respiratory system. Older adults like Mrs. Jones often have a decreased cough reflex, fewer alveoli, and increased airway resistance, raising infection risk. Her bladder? It's likely smaller, with decreased capacity and reduced renal blood flow. And her spine? Watch for dehydrated intervertebral discs, which can cause stiffness or height loss. But systolic blood pressure? That typically increases with age due to stiffer blood vessels, not decreases. Diagnosis D. Based on our assessment, we identify age-related changes affecting hearing, respiratory function, bladder capacity, and musculoskeletal health. These are expected physiological shifts, but they impact Mrs. Jones' daily life and safety. Planning P. Our plan prioritizes safety and education. We'll ensure clear communication for her hearing loss, teach infection prevention for her weaker cough reflex, and plan for frequent bathroom breaks due to reduced bladder capacity. For her spine, we'll encourage mobility exercises to maintain function. Implementation I. Now let's act. For presbycusis, we teach Mrs. Jones to face speakers and use assistive devices if needed. We educate her on deep breathing to support lung health and frequent hydration to aid bladder function. For her spine, we recommend low-impact exercises like walking. Patient teaching is key. Explain presbycusis simply. It's age-related hearing loss, not a disease, and manageable with strategies. Evaluation E. Finally, we evaluate. Is Mrs. Jones communicating better? Are infections prevented? Is she managing bladder needs and staying mobile? We adjust our plan based on her progress. Let's tackle the NCLEX question. Which age-related changes should the nurse consider? A. Progressive hearing loss. B. Decreased cough reflex. C. Decreased bladder capacity. D. Decreased systolic blood pressure. E. Dehydration of intervertebral discs. Correct answers: A, B, C, E. Rationale: older adults experience presbycusis, weakened cough reflex, smaller bladder capacity, and dehydrated discs. Option D is incorrect. Systolic BP typically increases with age. Clinical application: these changes affect safety and quality of life, so assess thoroughly and tailor care. Nursing tip: use clear, loud speech for presbycusis patients, but don't shout. It distorts sound. Love these NCLEX tips? Subscribe, hit the bell for daily drops, like, and share with your study group.